everyone! Thank you for joining me in today's video. My name is Paige Zachowska. I'm an International Board Certified Lactation Consultant. Today I wanted to talk on a topic that is very commonly asked. It's one of the first things to know when you start breastfeeding, actually. It's one of the best pieces of education you can get in your pregnancy. So the topic for today is actually going to be a deep latch technique. So a deep latch technique is basically a way to ensure that you are latching your baby deeply. And the reason why this is actually so important is because we really want to ensure when baby is coming to the breast that they get a deep latch, because if baby is not getting a deep latch, they're getting a shallow latch. And that is where, we commonly hear the horror stories. I was bleeding, I had a lot of pain, it was uncomfortable, etc. So by facilitating a deep latch technique actually will ensure that it is most comfortable for mom, which is one of the biggest reasons why moms give up a little bit sooner than they anticipated, is because it was uncomfortable. There is a way to make it comfortable for mom. And at the same time, it also allows baby to transfer and take in the most amount of milk. So basically, most comfort for mom and most milk for baby. Those are two very great things. So the reason why this is actually incredibly important is because there's a couple of little basics you need to know when latching your baby and when we're talking shallow latch versus deep latch. So this is my fun little breast model we're going to use to demonstrate. So when baby latches on the very tip of the nipple, what happens is when they are just right here on this tip, basically the tip of your nipple is being compressed and flattened, misshapen, while also being rubbed on the roof of the mouth where it is bony. So if you were to, with your own tongue, put your tongue on the roof of your mouth and run it from right where it's comfortable towards the back, you will feel that there's actually a bony cartilage structure, that's your hard palate, and then a little bit behind that is a spongy, soft area that is called your soft palate. So this relates to the deep latch in breastfeeding, because when baby is only getting the tip of the nipple, your nipple, there's not enough breast tissue in baby's mouth to actually help baby stretch the nipple. So it is just being compressed and rubbing against that bony structure. That's where damage comes from. So we want to make sure that we can allow baby to have enough breast tissue in their mouth to stretch that nipple to the soft palate. That is where it's most comfortable. That's where things go smoothly. So to start this off, the way that I like to explain it, essentially, is an asymmetrical latch. When you think about breastfeeding, you automatically think, okay, to breastfeed, we just insert the tip of our nipple like directly in the middle of baby's mouth, kind of like shooting darts. We want to aim it directly in the center. That's not quite how we're going to do it. So instead, we want an asymmetrical latch. We don't want baby to latch on perfectly symmetrical. We want it a little offset. What this does is it ensures that baby has a lot of breast tissue, that little areola. And when they get a lot of breast tissue in their mouth, that's where things work. So to do that, one of the first steps I encourage moms to do is to get baby to open up nice and wide. So first way to do this is actually to flirt with your baby, with your nipple. So you want to take the tip of your nipple and drag it from baby's nose down to their chin, back and forth. You can go side to side, however you want to do this. But basically, just flirt with your baby. Your baby is going to want the nipple, and they're going to want to latch. So they will likely eventually open up nice and wide. We want to wait until baby has a big Mac mouth, nice and wide, like they're really going in for a big Mac. And when they don't have a very wide mouth, that means they're not going to have a very deep latch. So those two things go hand in hand. So go ahead and start this off where you are flirting with your baby with the nipple, just until you see that nice wide mouth. Then, at the same time, another technique, this is just another trick, you can also actually compress your breast a little bit by putting a little bit of pressure with your thumb onto the breast. What this does, it basically points the nipple up. So you can do this before or after you start dragging the nipple near baby's mouth. Either one's fine. But when you have the compression and then we start flirting, baby opens their mouth nice and wide. Then when you start flirting and your nipple is compressed, baby's mouth opens nice and wide, then it's super important to bring baby to your breast rather than your breast down to baby. One of the first points of contact with breastfeeding is actually baby's chin. So when you bring baby to your breast, that contact with their chin is actually going to hold the chin open a little bit more. It's going to help stabilize that deep, wide opening in their mouth to ensure that they get on deeply. So the way that this looks from someone looking at the mother, we are going to start with a compression. So we're using our thumb to press into our breast, to tilt it upwards. Then we bring baby in close. A couple mantras, if you will, is nose to nipple and tummy to mummy. So you want to make sure that their tummy is directly on your tummy. I really like the cross cradle hold, especially for the newborn time, because it helps you facilitate and really control how to get that deep latch when they need it the most. So we got that compressed breast, and then we bring baby close, tummy to mummy, and nose to nipple. Then we start dragging it, our nipple around, we're flirting, we're encouraging baby to open wide. You can even express a little bit of breast milk onto the nipple and drag that around baby's mouth. This will encourage them to open wide. And once you see baby's mouth is open wide, okay, we plank, and then bring baby to you very quickly. And then get comfortable after that. And if this hurts longer than 20 seconds, go ahead and unlatch and try again until it is comfortable and until you see that nice deep latch. To unlatch, you can put the pinky in the corner of the mouth to break the seal rather than stretching your nipple, because that can also cause pain and damage. So just repeating this one more time for you. If you're pregnant, this actually might be a fun activity for you to do. You don't necessarily have to do it in front of everyone, but just kind of practicing the motions and getting ready for your baby. This, if you grab a baby doll or a stuffed animal, this might just be a fun way to prepare. So doing this one more time. So we started off where baby is close to us, and we are compressing our breasts, tilting the nipple up, and then we are flirting with baby with the nipple, encouraging baby to open nice and wide. And once they open nice and wide, we are aiming the under, like directly underneath the tip of your nipple. So the under areola is what you're aiming to get in baby's mouth. That is your center point, is the under areola right here. That's what you want to aim in the center. The tip of your nipple will go inside. Just trust, it will go inside. So aim right underneath the tip of your nipple, actually. So baby has opened nice and wide. We are aiming that under areola and bring baby quickly to you. Let them figure it out a few seconds. They are on. Now they just need to suck. If it's comfortable, great, you've done it. Get comfy, relax, lean back, however you want to do it. You can stay in this position where you're holding your breast, or you can relax into it, whatever's most comfortable. Thank you so much for watching. We'll see you guys again soon. Bye!